Hello, I just finished my Sunday morning ward rounds. We have a few patients on the ward. Some are recovering from their surgery and there are some waiting for their surgery. One patient is having a surgery tomorrow and two others will have their surgery later on in the week. Most patients come into hospital the day before their surgery. Some patients do come in a bit earlier because we have to do some further investigations or we need to get them in a better condition before their surgery. If there's any infection, for example, it is best to have this cleared before any heart surgery. Some patients, of course, need surgery because of an infection, for example, an infection of the heart valve or a collection of pus in the chest cavity. And in these patients, we would treat the infection as much as possible before the surgery. Patients with a poor heart function also have a higher risk for surgery. And in these patients, we would typically make sure that they are at least on a period of time on medications to improve their heart function, to minimize the risk of the surgery. And if they have respiratory or kidney problems, these can also increase the risk of heart surgery. And so we will optimize this as much as possible. And of course, the general condition of the patient is important. Some patients are very frail, for example, and we would need to optimize their nutrition and also teach them some basic exercises to do before their surgery. We can objectively calculate the risk of heart surgery using something called the Euro score, which takes into account all of these factors and others as well. And so we can advise the patient and their family accordingly about the risk of their surgery. So thank you very much for listening. It's almost midday now, and I'm going to go home now to have lunch with my family and hopefully have a restful day ahead. Thank you.